Hi, I'm Melanie Palm, Dr. Melanie Palm from Art of Skin MD in San Diego, California. And today we're going to be showing Restylane Silk in the lips, which is a very small particle version of Restylane. It's sort of like lip gloss. It just enhances the lips. It doesn't necessarily build lip augmentation or make the lips bigger, but we use it to just sort of smooth out the wrinkles and just enhance the overall appearance of the lips. So this patient's had it before. We're just doing a little maintenance go. We're going to bring the camera down and up and around to her lip area, and I'm going to start on her upper lip region. I'll have you open your lips just a little bit, and I love to catch a little bit of that lip border, so I'm actually going to bend my needle a little bit, and we're going to put just a touch in that magic space, and you can see it actually travel across. That's perfect. If you're in that nice glide space, it's actually come all the way over to that area, which is fantastic. And then I like to go kind of 2/3 between the dry and wet border, and you just want to get what's in what's called the submucosal space, which is quite superficial, and you don't want to be in the muscle because that's what causes a lot of the swelling that's related to the Restylane Silk. But if you're in that right glide plane, it just kind of flows across and is super, super pretty. So a little poke again. This patient's got Fordyce spots, which are little oil glands that you can sometimes view on the lips. So those little dots are totally normal, just normal anatomy. I'm going to come over to the other side and we're going to treat this part of the upper lip. And I'm using small amounts, and as opposed to some of the other fillers that we use where we sometimes do a lot of massage, this is definitely not a filler that you want to do a lot of massage or manipulation with. If you do that, you're much more likely to cause some problems in terms of swelling, and the patient obviously doesn't enjoy that. Again, I'm just real superficial and along that glide plane. And it doesn't take much, so actually a syringe of this Restylane Silk material lasts quite a long ways. You can definitely treat a full lip with this. It should just be pretty and atraumatic for the patient. She's doing awesome. We're basically done with the upper lip. But I do like this product if I've got patients that are beginners. I think another nice product for beginning sort of patients that, like the idea of lip augmentation, but we don't want to do anything that's too dramatic, as Volbella that came out. And it's really nice, I think, similar sort of lip gloss, but can build a little bit of volume over time. So we're going to work on the lower lip a little bit. A little teeny poke. Good. Little poke again. Awesome. Good. And then again, I'm going to do that little dot along the wet-dry border between the two spaces in that submucosal plane. And again, it's just kind of adding like a smooth coat to that area of the lip. So a little bit on her border here. And then we'll finish up with just a little bit, actually here, just in front of that wet-dry border. Perfect. And then I've got a little bit left, so one area we start to lose a little volume in the upper lip is just right beyond what we call the white part of the lip, or beyond this vermilion border. So I'm going to put just a teeny bit here to support this. It's one of the first areas we start to lose a little bit of support there. And then on this side as well. And again, just a small amount, so you don't start to get that shadow there, and we want to support this outer part of the lip. But that's super pretty. You can get a little bit of swelling. I do tell patients with Restylane Silk it is possible. It just depends on the patient. To give it about a week for it to settle out, but this patient shouldn't have any bruising, and that's a really nice result. So if you've got questions about Restylane Silk or Volbella or the other similar fillers that are used for lip augmentation or enhancement, give us a ring at Art of Skin MD. It's 858-792-7546, or you can look at our website, which is artofskinmd.com.